From Studio 3C in Rockefeller Center, this is News 4 New York.
Hospitals are on the road to recovery in New York, and Governor Cuomo lifted the pause restriction on elective surgeries in many parts of the state, including Westchester and Suffolk counties. These surgeries are also now allowed in Connecticut and New Jersey, getting the green light next week. But News 4 consumer reporter Linda Baccaro found out that scheduling a medical visit right now is very different.
More than 2 months after a wave of COVID-19 patients, hospitals are now ready and eager to resume seeing non-COVID patients.
We want to make sure people who need medical services are getting medical services.
The director of surgeries at White Plains Hospital says he sees firsthand why delaying medical care can be dangerous and costly.
And as a result, they wound up staying in the hospital for a week or two, much longer than they would have had to.
When making an appointment, patients must be tested for the coronavirus. White Plains says it can do that the same day as your surgery. Only the patient should enter the medical facility, and operating rooms have UV light to disinfect and additional air filtering.
We're asking that all patients and staff wear masks. We are staggering our appointments so that we're not overwhelming our waiting areas.
Healthcare professionals are also urging patients to resume well-care visits like annual checkups. And if you have another reason to see a medical provider, remember that in some cases, those visits can be done virtually or through telehealth.
Routine physicals, screening exams such as mammography, colonoscopy, those all need to resume because those diseases don't go on pause.
With money spent preparing for COVID patients and money lost from elective surgeries and ambulatory care, the American Hospital Association says hospitals are losing $50 billion a month nationwide.
Those are funds that were not planned for. That's not an insignificant investment. And so being able to get those spaces back to function the way they were designed is going to have an important impact on the financial health of the hospital.
With so many procedures delayed for so long, though, patients can anticipate a backlog. In White Plains, Linda Baccaro, News 4 New York.